Hey everyone, I hope that you're doing well. My name's Daniel Williams. I'm a registered respiratory therapist. I practice in the state of North Carolina. Also teach full-time in a respiratory therapy program. One thing that constantly gets said from my students from time to time is that they wish there were some more resources on the internet that were able for them to search through while they're working on studying throughout the curriculum, the program, and what have you. So the overall goal that I've got is to produce a series of videos that will serve as a resource for my students, but also serve as a resource for anybody that's prepping to become a respiratory therapist, a registered respiratory therapist, because that's important. So if you want to be a respiratory therapist, a little bit about myself. I went into respiratory therapy right out of high school. Academically, to this day, the associate degree respiratory therapy program is the hardest thing that I've ever done. And I have a bachelor's degree in respiratory therapy, as well as a master's degree in adult education, as well as a certificate in community college instruction from graduate school. and although each discipline had its own rigor, definitely, I still have to say that academically, the respiratory therapy program was the hardest thing that I'd ever done. Maybe because I didn't have a whole lot of life experience getting into the profession, because I did join the program immediately after graduating high school. So I graduated in May of 2004 from high school, started August of 2004, graduated in my associate degree respiratory therapy program May of 2006, then BSRT program December of 2008, took a couple of years off just to concentrate on working, and then went back and got my master's degree in adult education, because I decided that a career in education is what I wanted to pursue, in respiratory therapy education specifically. So I've been fortunate to work with a lot of students. I've been fortunate to come through a really good program. And to be a member of a really good program as we're going through that. So part of that is, my job is to teach and try to make things more easily understood. So that's going to be, in essence, the goal of these series of videos that I'm going to put through. So what I wanted to go over first is, if you want to become a respiratory therapist, some of the things to think about, that you may not have thought about before. You want to make sure that you're attending a respiratory therapy program that is accredited by the Commission on Accreditation for Respiratory Care. So I'm sharing my screen with you now, and we should be able to see that we are on the COARC webpage. So it goes over accreditation, program resources, site visitors, if later on down the road you decide you might want to become a site visitor. There's also a students tab, and under that students tab, you could have a couple of different, you can put in a complaint if you need to. What should you know about the overall accreditation process? Basically, when you graduate, you're going to be eligible to take an exam through the National Board for Respiratory Care. That is the therapist multiple choice exam, or for short, the TMC exam. And in order to be able to sit for that exam, you've got to make sure that you graduated from a COARC accredited program. So it is important to make sure that the program that you're going through is in good standing with the Commission on Accreditation for Respiratory Care. So if you'd like to find an accredited program, just click on that particular tab, and then you can go through and click on the accredited programs by state. I happen to live in the state of North Carolina, and if I'm not mistaken, there are 14 accredited, associate degree programs. We've now got a baccalaureate program in UNC Charlotte, which is COARC accredited, and there's a new baccalaureate program that started up at UNC Wilmington that is in the processes of becoming COARC accredited. So if we look here, we've got Forsyth Technical Community College, Durham Technical Community College, Central Piedmont, Sandhills. We don't need to go through, but just shows you all of the programs that are COARC accredited. So they have gotten provisional accreditation, it appears, at Wilmington. So you can go through either state and, depending upon what region you happen to live in, and find those COARC accredited programs throughout those states. So this is really helpful depending upon where you live, and seeking the overall colleges in which that you would like to go to, and obtain that from. So after you've been accepted into your respiratory therapy program, obviously you need to make sure that you are equipment oriented. The NBRC develops the credentialing exam. So you will take the credentialing exam after you pass school, and that's going to have you credentialed nationally. So it's a nationally recognized credential. Your RRT is a nationally recognized credential. And then you've got to apply for the specific state license. So for instance, when I graduated the program, I went to Forsyth Tech Community College. When I graduated that program back in 2006, had to take the it's different now. They've got one exam where you can score at a CRT level and the other you can score at an RRT level. But when I took it, I had to take the CRT exam as well as the RRT exam and then the clinical simulation exam. So there were 3 exams that I had to take before I could actually get my RRT credential. But I couldn't go to work immediately after that, because I lived in the state of North Carolina. After obtaining my RRT credential, I needed to go on and get my license so that I could practice. Now, during the time that I had that, they had provisional licensing, and you could become licensed with your CRT, but I had the full license, and it's still currently active in the state of North Carolina after passing the RRT. So you go through the state licensure application process, and that process is different depending upon which state that you live in. So for instance, I live in North Carolina. If I wanted to go work in Virginia, I would need to apply to the state licensing board for Virginia to get a respiratory care license up there. My credential is nationally recognized, but I would need to get a Virginia license in order to be able to practice technically within Virginia. Same with Tennessee, same with South Carolina, Georgia, Florida, any of those. I would have to get a license in those particular states to be able to work in those states as a respiratory therapist. The credential is nationally recognized, but you've got to apply to individual states for those specific licenses. So that's important. So I always tell my students that it takes anywhere between $500 and $1,000 to become a respiratory therapist after you've successfully completed a co-ARC accredited respiratory therapy program. So with that being said, your TMC exam, there's a high cut score and a low cut score. The low cut score gets you the CRT credential. The high cut score puts you in a place where you can sit for the clinical simulation exam. And then after a successful completion of the clinical simulation exam, you can then be awarded your RRT credential. So that's a little bit about the Commission on Accreditation for Respiratory Care, how to go about finding an accredited program. Really good resources available to you. And then I've mentioned already the National Board for Respiratory Care, the NBRC. So they've got a website. It's www.nbrc.org. Here you can click on some different resources if you'd like. I mean, really a lot of good stuff concerning respiratory therapy can be found right here within this particular site. But one of the things that's going to be of importance to you is the exams tab. So I've already pre-clicked on the exams tab. So the exams that you have available to you to take upon your completion of a co-ARC accredited program is going to be CRT. And again, that's your TMC, the therapist multiple choice exam, or for short TMC. You've got 2 different scores, a high cut and a low cut. The low cut puts you at the RRT level. The high cut puts you at the RRT level. The low cut puts you at the CRT level. And then after you score at the high cut score, then you've got to take the clinical simulation exam to get your full RRT credential from them. Then you can go on, if you like, and take the pulmonary function technology examination. You can take your specialty examination, such as the adult critical care specialist. I have taken and successfully passed that. I've taken the neonatal pediatric specialist credential as well. So I've got the ACCS as well as the NPS, in addition to my CRT and RRT credentials from the NBRC. Now I got a lot of experience with sleep disorders and so forth. I mean, we teach it, but as far as having a work experience is what I meant to say. I've not gone on to take that credential yet. Maybe in the future I will, and maybe in the future I'll do the PFTs, just because that's kind of an interest to me later on down the road. But the one that you need, your entry level, is going to be to get your RRTs so that you can work. There are some states that will allow you to work as a CRT, but the majority of the states are pushing for the RRT credential. So when you're looking at and you're in the program, the test is comprised of 3 different types of questions. And the test, I'm talking about the therapist multiple choice exam, that you have going to be scored at the high cut and low cut score. It's a 160 question exam. 140 of those questions actually count for you or against you, and then 20 of the 160 are field test items. So that meaning they will not count for you or against you. They're in there. So you want to make sure that you answer every question on that exam. As you're going through and prepping for the exam, it's easy to finish up a program and decide that, and because there's some review companies out there, Catering Review, and they're all great resources. But, of the mindset that I had when I finished school was I was studying for 2 years. So I didn't pay for any extra type of review or anything to that effect. I just went to, took the exam and passed them. But, I understand that individuals enjoy review materials, but as you're prepping for that exam, depending upon where you are in the overall program, I'd mentioned it does take between $500 and $1,000 to become a respiratory therapist. This TMC exam is $200. And then if you've got to repeat it, they offer you a discounted price for the repeat, and you can repeat it up to 3 times. And then if you don't pass it, within the 3rd attempt, you've got to wait, I think it's like 120 days before you can challenge the exam again. And then you've got the clinical simulation exam, which is $200. So between these 2 exams here, you've got a couple of $100, and then there's probably going to be, anywhere between $100 to $200 licensing fees and so forth by the time you go through the background checked and what have you. So that's important stuff to keep in mind. And that's why you really want to be prepared for the exam when you go take them. That way you're not having to shell out an additional $190 or an additional $200 to take those exams. Make sure it's one and done. Pass at the high cut score, and then go on and take your clinical simulation exam. So I'm going to click on that tab for the RRT. And it tells you that you can apply for the examination here. I want to show you that it also gives you a free practice exam that you can take, but there's also a self-assessment. So the NBRC's got a self-assessment exam for the TMC that you can purchase and take. I'd have to go back and look at the frequently asked questions, what have you, but I want to say it's in the ballpark of $50 to $60 to take that. The difference between these 2 exams, yes, they're still both NBRC style exams because they are coming from the NBRC. But with this free practice exam, you're going to get a score report, and that score report is simply going to tell you what you missed and what you got right out of the particular sections as it pertains to the detailed content outline, which I'll get to here shortly. The self-assessment that you purchase will actually give you what you got right, what you got wrong, but it also provides rationale. So I find that to be extremely helpful when going through and doing studying and preparing to take the real deal exam. So I find that to be super helpful because of the rationales that it provides you. Because going back to the way that the tests are written, the NBRC writes questions, there are recall questions, application questions, and analysis questions. So those are the 3 types of questions that you have on there. Your recall questions are the easiest, but as I always tell everybody, they're only easy if you recall the information. Then you got your application questions, which kind of pick up the pace a little bit and overall rigor or level of difficulty. And then you've got your analysis question, because there's a massive amount of stuff that you're going to have ventilator settings, blood gas settings, patient assessment, information, different types of blood results, maybe some chest radiographic information and data that's going to be provided. We've got to kind of put all that information together and develop and come to what's going to be the right answer. And if that weren't difficult enough, the NBRC writes questions to where, out of 4 answer choice, because they're multiple choice questions, so you've got A, B, C, and D to choose from. The answer choice A is a plausible, feasibly correct answer, and answer choice B may be a feasibly correct answer, but there's going to be something within the word stem or the wording of itself that makes that the best or the most correct answer that you've got listed there. So we want to make sure that we know things, we have the ability to critically think as well. So and the self-assessment for not only the TMC, but the clinical simulation exam as well, once you get to that point. But you've got to pass the written exam before you can get to the clinical simulation exam. You heard me mention the detailed content outline. You can pull up the detailed content outline for the TMC written, and there's a detailed content outline for the CSE exam as well. We'll pull up the detailed content outline for the written exam. Those are the 3 types of questions that I mentioned: your recall questions, the application questions, and the analysis questions. Then you can go through the sections of it. So you've got your patient data, and it will tell you out of the 100, you got 160 question test, 140 items are going to actually be scored, count for you, count against you. It gives you the total, the approximation of the numbers of those types of questions that you'll have on the version of the exam that you get. So patient data, there's a total of 50 questions. We break that down into there's 15 recall questions, 27 application questions, and 8 analysis questions for a total of 50. And then as you progress through each one of these particular sections, it'll let you know if there's, happens to be 4 recall questions, 6 application questions, 0 analysis questions. So then you're going to proceed as you're studying, and this is how you'll prep your studies, go through patient history. And as you're studying, you can utilize this detailed content outline in addition to the other things that you're studying and the things that we'll go over. And as I create more videos in the future, I will try my best to kind of match everything back to this detailed content outline as we can moving forward. And hopefully my goal is to keep those reviews at 15 minutes or less, plus or minus maybe 5 minutes, but I'll shoot for 15-minute chunks of information at a time as we move through that. You've got to evaluate data in the patient record. With that, you look at your patient history, for example, so you look at the overall history of the present illness, look at the orders, medication reconciliation. So that's where you review the medication that they might have, where you can look to see if there's any type of interaction that, whether that be a negative interaction or a positive interaction that may happen if you're prescribing, or not necessarily prescribing, but if you're administering another medication. Progress notes, physical examination relative to the overall cardiopulmonary system. So understanding the systemic system versus the cardiopulmonary system, understanding that, you've got a heart that's got 4 chambers, but they're broken up basically into 2 sides. You've got the right side of the heart that is primarily responsible for pumping blood into the pulmonary circuit, while the left side of the heart is primarily responsible for pumping blood into the systemic circuit. And those have to kind of be in balance, or else, and the heart's always a forward pumping organ. So, and that's some topics that we'll get into. This basically is just supposed to be an overview as opposed to more or less a teaching item. But this is a really great resource, and, it's 14 pages long. So I won't read through everything, but you've got trends and monitoring results such as your fluid balance, vital signs, intracranial pressure. If you could talk at length about each one of these items, I'd say you're probably pretty well prepared for that exam. So as you go through here and you're planning on your studies for the TMC exam, if you've got this section pretty well taken care of, I might review it once or twice, but I'd go into the other areas that you don't feel as strongly in and focus more time on those items. So, you should not ever be going into that TMC exam blind. One, you are going to be going into, or maybe have already completed, a co-arc accredited program. So that curriculum was supposed to have been designed so that, everything that you've done is aligning with the detailed content outline of the NBRC, so that you can successfully pass and complete that exam at the RRT level. So you shouldn't be going into that exam blind at all, because it breaks down for you what's on the exam, and although it's a primarily adult exam, there are going to be some neonatal and pediatric stuff on there as well. But this 14-page document goes over a lot of really good stuff, a lot of good areas that you need to really hone your studies in on and work on practicing as you are a student, or going back and reviewing as a graduate, either way. So the same thing is true with the clinical simulation exam. You've got the clinical simulation exam detailed outline. So once you successfully pass and complete the TMC exam at the high cut score for the RRT, then you can go take your clinical simulation exam. And some people kind of get it in their head that with it being clinical simulation, you're actually going to go in and perform procedures or what have you. That's not the case. It's going to be a clinical scenario or a case study type thing that's on a computer. You'll go through, you'll read a situation, you'll click some answer choices, and then you'll be presented more information. You may have a physician that agrees or disagrees with what you're going to do, and then it progresses through an algorithmic approach to that effect. And if my memory serves me correct, it's 22 cases, and 20 of them are scored, 2 of them are practice cases. But again, so I was just pulled up the clinical simulation exam detailed content outline, and we had up the TMC detailed content outline. You'll notice that in studying for the written exam, you are indeed studying for the clinical simulation exam, because you can see that the patient data, the evaluate data, the patient record, A lot of that stuff is just about verbatim, the exact same stuff that shows up on the other detailed content outline. So I would utilize the detailed content outline to help guide your studies as you go through there. And then lastly, before we get into any kind of educational videos or anything to that effect, I do want to point out one other resource that you've got available to you, and that's the American Association for Respiratory Care. So it's our professional organization as respiratory therapists. So you can join that as a student. You get a discounted membership if you like to join as a student. And then, it would be advantageous for you to maintain that membership after you finish school. I've maintained my membership for several years now. As a registered respiratory therapist, I've been able to get discounts on getting into conferences and things, because you are committing to a lifelong profession of lifelong learning. So lifelong learning within your profession, because healthcare is always changing. And we found that to be very true, even within the last year or two that we've had. But nonetheless, I'm hopeful that you'll appreciate the videos that I do. The last class that just graduated bought me a GoPro and asked me to get some videos posted for future students, and in case they wanted to go back and look at anything for review. So it's my goal over the course of the next couple of years to get as many videos as I can done to share what I know about respiratory therapy with you, and hopefully help you along the way as you're studying and preparing for the TMC board exam that you've got to take after you complete the program. So thank you for your time and attention. I'm going to go ahead and stop this recording, and you all have a great day, and let me know if there's anything that you would like to be gone over specifically. You can put that down in the chat box or below, and if you you can also subscribe to the channel, and that way hit the notification bell. That way you're notified when I do finally get new videos up and running. Thank you again. Have a great day.